Hello and welcome to this Q&A from the Fertility Alliance. Today we're going to be talking about unexplained infertility, and we're joined by Dr Sesh Sunkara, who's from King's College London and King's Fertility, who's going to be talking to us about unexplained infertility. So I wanted to start by asking you, what is unexplained infertility?
So, unexplained infertility literally means what it says, that is, the infertility is unexplained. When a couple or a heterosexual couple who are trying to conceive have standard investigations and these investigations are normal, then we call it unexplained infertility. So, you might ask, what are the standard investigations? The standard investigations are simply tests for ovulation, tests to see if the tubes are patent, and tests to see if the semen analysis is normal for the male partner. So these are the standard investigations, and if these investigations are normal, then it is deemed as unexplained infertility.
So if you've had all those tests and they were all normal, but you're not conceiving, you still have a chance, presumably, of conceiving naturally.
Yeah, so infertility definition is that a couple who have regular unprotected intercourse have difficulty conceiving after 12 months. It is infertility, it is not sterility. So you're having difficulty conceiving, but not sterility. That means it's not an absolute no. So if a couple are trying to conceive and the standard tests are normal, that is the tests for ovulation, the tubes are patent, and or nothing to suggest that the tubes would be blocked and the semen analysis are normal, 84% of them will conceive within the first 12 months. So within 12 months or a year, you have a significant proportion of a couple who will conceive. And of those who don't conceive, 92% will conceive by the end of 2 years. So yes, coupled with unexplained infertility do have chances of natural conception. The maximum chances of any couple trying to conceive when everything is normal is within the first 12 months of trying, followed by the second 12 months. After that, the chances become a little bit lower, but it's not absolute zero.
And how common is unexplained infertility?
Yeah, that's a good question. So I'm talking in the context of heterosexual couples. So if a couple are trying to conceive, then a third of cases we find that all the standard tests are normal, and therefore we give a diagnosis of unexplained infertility. So I'm constantly referring to as standard tests for both the partners, and I'm saying tests for ovulation. And I can preempt you. You might ask, what are the tests for ovulation? So I can say that if you look at simple tests can be very predictive. So one of the easiest way to say whether a woman is ovulating regularly is a cycle, her menstrual cycles. If a woman has regular cycles, regular menstrual cycles, which you have say between 24 to less than 38 days, then you can say that her cycles are ovulatory. There is actually no need to do any additional tests such as urine LH testing or even progesterone blood test to confirm ovulation. The history that the cycles are regular itself is a good enough or a sensitive enough indication that the cycles are ovulatory. With regards to tubal patency assessment, if a woman has not had any history of any infections, pelvic infections in the past, or sexually transmitted infections, or who has not had any gynecological surgeries, then we can say that the tubes are patent. If the woman wants to have them tested, yes, we can have them tested, but in the absence of any comorbidities, you can confidently or say with fair confidence that the tubes would be patent. And the semen analysis would be from any accredited laboratory, and they will assess it as per the WHO criteria.
For couples with unexplained infertility, it can be an incredibly frustrating diagnosis. And I think people often want to get to the bottom of it. So they want to go off and have lots more testing. What would you say to people in that situation who are maybe trying to look for whatever other tests they can have that might explain what's going on?
That's a very good question. You know, as good as that, there is nothing that is abnormal with the investigations, and therefore the diagnosis is unexplained infertility. Many individuals or couples would want to have some diagnosis, something that is not right that can be corrected. So I would say to couples, or I would say there is no necessity to have additional investigations unless indicated by history, because the more investigations you do, you might, which are not relevant, you might end up with results which again are difficult to interpret. And also you would not know what to do with following these unequivocal results or results which we cannot interpret in the context of unexplained infertility. And the most and, and you know what could easily happen is you can go down the path of over investigations which are not necessary, which are not necessarily logical, and also unnecessary interventions, when all this will not necessarily translate into improved outcomes. So as much as it is frustrating, which is really understandable, there is sometimes no necessity to do unnecessary investigations, because that will only increase the cost, expenses, or expectations, which not without necessarily translating into beneficial outcomes, if that makes sense.
Yes, it does make sense. What about with IVF? Are the chances of conceiving quite good for people with unexplained infertility compared to other people who are having treatment?
Yeah, that's a good question again. So, for unexplained infertility, IVF is a treatment option. Again, it depends upon how long the couple are trying to conceive for. It is not the only treatment option, it is a treatment option. Um, and with IVF treatment, as with any individual or couples undergoing treatment, IVF treatment success is dependent upon a woman's age. The most important prognostic variable with regards to IVF success is a woman's age. So IVF success depends upon the woman's age, and also IVF, because with IVF treatment, what we're doing is we're stimulating the ovaries to get a good number of eggs, more than we would in a natural cycle, and to create good quality embryos, not only the one embryo that goes the first time, but also freeze embryos, so that we can make one cycle more successful in case the first one doesn't result in a pregnancy, or if the first one results in a pregnancy, if the couple come back again to expand that family. So IVF ovarian stimulation, and how we respond to the ovarian stimulation very much depends on a woman's ovarian reserve or egg reserve. So if the egg reserve is good, then better response to stimulation and better chances of having more good quality embryos to increase the overall success of IVF treatment. So the two factors, important factors, I will not say the only factors that will influence IVF success, whether it is unexplained infertility or otherwise, is a woman's age and a woman's ovarian reserve.
And I think that people with unexplained infertility are often quite interested in looking at things like diet and lifestyle, and can become understandably quite concerned that there may be things in their diet and lifestyle that might be making a difference. Do you think you can see real differences if people start improving their lifestyle and diet?
Yeah, I would say it's always important to adopt healthy lifestyle measures and dietary measures, because, for example, stop smoking, optimize on weight, and for women, make sure that you're up to date with your cervical screening. I mean, it's not healthy lifestyle measure, but part of your health. Regular health checkups. Go on folic acid. Make sure that your diet is balanced, because there is an impact on fertility and reproductive outcomes. It's not just your fertility, but also your pregnancy and reproductive outcomes. So it is always important to optimize your diet and lifestyle, and that is irrespective of whether you're trying to conceive in the next 3 months or you're trying to conceive in the long run. So it is important to start now with healthy lifestyle habits.
The other thing I think people can be more interested in is, there are lots of different interventions out there now. There might be things like complementary therapies, like acupuncture, or maybe something like antioxidants. And I think when you don't have a reason for your fertility problem, though, all of those things can be much more attractive, really. And I wondered what you'd say to patients who feel they ought to be paying for some of those things just in case they can make a difference.
Yeah, that's a very good question, Kate. And I see a lot of patients who go on because, as I said, as good as it is that the standard tests are normal and nothing is abnormal, sometimes patients want to have some answers. With unexplained infertility, as I said, the chance you're infertile, you're not sterile, so you still have a chance of conception. But if you're looking for treatment, yes, there are treatment options which you discuss with your fertility doctor. But there are a lot of complementary therapies, and nowadays, with the access to the internet and social media, I do see patients taking a lot of complementary therapies or asking about complementary therapies. So we recently published a guideline, the ESHRE guideline on unexplained infertility, which is available for everybody to access, and there is a patient version as well for everybody to access. So we did look at certain aspects or adjuvant therapies, as we call, or add-on treatments, and we found that there is no evidence to suggest that any one particular will improve outcomes. For example, antioxidants, whether you acupuncture, they're not going to change your fertility, they're not going to improve your infertility, or they're not going to change your reproductive outcomes. If you want to take it, you can take it for any other reason, but if you think taking it on the premise that it is going to change your infertility or improve your infertility outcomes, then that's not right. So if you're taking it, any of these complementary therapies, there are a list of them, and if you're taking it specifically saying that you're treating your infertility or unexplained infertility, then it is absolutely not correct. If you want
Are,
to take it for any other reason and it is not harmful, then that's fine. But don't be misled that it is a treatment.
are we actually seeing any reduction in the number of cases of unexplained infertility as our knowledge about fertility grows and gets better?
I would say it's more or less stable, but or I would say that as couple are more aware and having, if they're approaching for investigations earlier, we're picking them up sooner. So I would say it is more or less a stable, a third of couple. Yeah, that's what I would say. But I would say that definitely the awareness has increased among individuals, which is a good thing. But I think there should be more awareness as well. More awareness on when to reach out for investigations, what investigations should be done, what investigations should not be done, because over investigations as well is not a good thing. It will lead to unnecessary anxiety when there are not necessarily answers, and also not necessarily any interventions based on those additional unnecessary investigations. So yeah, that's what I would say.
And finally, I just wondered if I could ask you to kind of summarize maybe your thoughts. I mean, I know that unexplained infertility is so frustrating sometimes for people. And what do you say to patients who come to see you who are just feeling really frustrated and just want answers?
Yeah. So I will say to couples, you're not the only ones in this. There are many couples, as I said. If you say 1 in 7 heterosexual couples in the UK have a diagnosis of infertility, and about 1/3 of them have unexplained infertility. So you see, there are a lot of people like that. It's only that infertility is not discussed with each other, and therefore we find it lonely. We find it as just ourselves. And I say to you, and I ask you to, and I would reassure you that that it can be managed, and don't over investigate yourself, over treat yourself. Seek advice from a fertility specialist, and let the right things be done. And also, it is not a zero chance of conception with unexplained infertility, so just bear that in mind. Yeah, and when you're going through this, it is a journey, and hopefully you will come to the outcome at some point.
Dr. Sesh Sunkara, thank you so much for joining us and thank you for sharing your knowledge and expertise on unexplained infertility.